My name is Dr. Adeleke. I'm a consultant family physician and director of health services for Bowen University. I want to start by appreciating Cell Foundation for this visit, this awareness campaign. It's been a source of inspiration. It's like a dream coming true actually for us, seeing this big foundation in Bowen University. And a lot of students are actually very excited, about the campaign and the advocacy you just made. We are really grateful for that. So this is Bowen University, and we enjoy the support of the university management, even our hospital, Bowen University Hospital here. We thank God for what they are doing. We thank God for their commitment. They have been showing massive support actually for the well-being of us. There are a lot of things in place there that you will not just see elsewhere, starting from the Vice Chancellor, all the principal officers. They are so committed to the well-being of our students. But let me also talk briefly about what we've been doing. I'll still bring in how they've been supporting us. We have a support group here known as Bowen Champion Group for our students living with sickle cell disease. Quite a number of them are in Bowen, and by God's grace, we've been providing holistic support to them, not just medical aspect of the care. Okay, so the foundation was set up for that, support group was set up for that. We have a lot of healthcare professionals in our midst. We have not less than 5 hematology. We have a professor of orthopedics because of the bone issues that may come up. We have a professor of nephrology from UIT, the professor of neurology from UITH. One of our board members is currently in UK, former acting head of the department of hematology for UCA. So we have all the network, professional network in our platform. We have our students in the same platform. We also have volunteers, including some of our nurses, other staff in the hospital, doctors, my colleagues, and parents. It's also interesting to know that parents are also supporting what we are doing, and quite a number of them have really been supporting us. So in that particular group, when we started February 2023, and since then we've been consistent. I remember they have said we started having monthly lecture series to bring in different professionals that are involved in the care of sickle cell to educate our champion, their parents, and even the healthcare professional about what we need to know about different aspects of the disease. And it's a very heterogeneous group, and we learn different things in the same platform. And so over the year, we were able to condense the lectures together, and that was how we came up with a publication titled The Compendium, like a compendium of different aspects of the disease, the central nervous system, the bone aspect, all the components are there. And I must also tell you that we got the support of the Bowen University Parent Association Forum to publish this book. So, and that's why we are making it available free of charge to our students in Bowen and people outside Bowen. And that's part of the support that we enjoy in the community. So we have, if the parents are supporting us, the directorate, the other directorate, there is the Directorate of Student Support. The director of that directorate is a member of our group, and that is actually helping us to make advocacy in the hostel. Okay, so our champions, we call them champions, they get a lot of support from the hostel. They actually have the opportunity of choosing the room they want to live and giving us the choice of who is going to be their roommate, somebody that is going to support them. And we've been doing that for at least about 2 years now, including the students in the clinical side in Ugoma. So when they cross over to Ugoma, so they prioritize their accommodation as well. So we've been getting that support from the management. All right. I'm also glad to inform us that other members of the university management are also part of our board member in the group. You met Professor Oladele, who happened to be a champion. So it's our father. The registrar is also a member of the forum. And so we get all the support that we get in the group and the university management. But beyond just supporting the group, the university management has actually been supporting the hospital immensely. Anytime we need anything, we supply without any bureaucratic delay. I'm glad to tell you we have a blood bank system in the university hospital. Our hospital is one of the few university health centers, people call it, that have a blood bank, a very effective and functional blood bank system. So the management was able to provide that. And anytime we are in the need of blood, I must say, we get prompt, massive support from our students. You were in chapel when some names were called out just today. About a week ago, we had a student who had crisis, a very severe complication of sickle cell disease that needed blood and some other care. Immediately, we reached out to the student body. In less than 20 minutes, we have 12 students already in the hospital. I mean, we call them at 9 p.m. and in the space of less than 30 minutes, they are already here. And we got 6 donors. I mean, 6 people that donated 6 units of blood already. We have to stop them. So, and it's not the first time. Anytime we reach out to the president, the director of student support, will get that kind of support. And of course, the management too has always been supportive. Even the case I just pointed out, the university management, the university vice chancellor himself came to the hospital, together with some other principal staff, principal officers, to check on the students, to encourage the students. And so we've been enjoying that support. I must also tell you that Bowen is one of the few hospitals where when students are on admission, they will eat 3 square meals a day free of charge. And so the support system on the part of the management is there. The support system from the other directorate of student support in particular, is there. Other members of the management team have been very supportive, and of course the hospital side. That's actually overwhelming. Our nurses are very fantastic. There's a way they welcome patients, especially this champion. Before they see doctors, they started enjoying the support, and of course, by then they see doctors, the care is, by God's grace, comprehensive. The way we manage pain here is remember the way we get outside the hospital. And I must tell you, our hospital at the University Hospital, we have the regulatory approval from NAFDA to stock morphine. And the past 1 year, we've been using morphine safely for our patients. That has bring a lot of relief for them when they have pain. It's not just morphine, of course. There's a way we manage so that every 4 hours they get good pain relief. And I have been, by God's grace, good here. So we thank God for our body. And of course, I must not forget to appreciate God. Because no matter what you do, if you don't see the handwork of God in whatever you do, it won't succeed. So God has been deeply involved in our affair. And I would say that's one major secret that I must not forget to say. We have issues. Sometimes I make consultation with very senior hematologists when there are things that are not very clear, and I must at this point actually acknowledge the number of my trainers who have also been very, very supportive. Dr. Wakim Bola is one of them, is one of our board members. And then Dr. Awonide is also an hematologist and a teaching assistant. So anytime I have some challenges as a family physician, I'm not a core hematologist, so I just use the challenge that I see that made me to take interest in them, develop interest in the field. Okay, so I still go to consult them, and they've been very available, willing to support all the time. And with our partnership and God on our side, we're managing them successfully to the glory of God. So we're happy about this partnership from Sickle Cell Foundation, and we know it's going to make our hospital better. Thank you very much. Of course, we know it's going to benefit our students that really need your support ultimately. Thank you very much. Well, we just have to appreciate Sickle Cell Foundation of Nigeria for this very huge opportunity that you are giving us. I must say, we are actually overwhelmed. I don't know, but management is very, very happy about this door that you have opened to us. And we know it will just be the beginning of greater, more glorious things that will come. And the students have a lot to benefit. Champion, those one are always there to add our priorities. So we're happy that you have some programs, some skill acquisition programs for them. This is something very good. Bowen actually encourages entrepreneurship. And that's in line with one of the core values of Bowen University. So, that will benefit our students, champion immensely. So we'd like to tap into that and look forward to having that done very soon. We also talk about the fact that we will get this team medication from Sickle Cell Foundation. I'm sure it's going to be a huge relief to our students and to the parents. So on behalf of the parents, I also want to appreciate Sickle Cell Foundation for giving us that opportunity to get drug coming to our hand here. Then the fact that our students will have the opportunity of doing internship in your reputable laboratory, that's a huge benefit. A lot of students actually have approached me since you announced it in chapel, and they really look forward to it, and we pray that it will become a reality very soon. So we really appreciate that. And then in terms of the support for awareness curation in the community, I forgot to mention the fact that we have actually started that we are doing a lot on our side. I also have to acknowledge Sickle Scan at this point. They gave us free Sickle Scan kit to do genotype, to carry out genotype testing for core members. And by God's grace, we've been to at least 2 group of core members, 2 LGI where we have done some advocacy campaign and we're able to do free genotype testing. Okay. So we'll be glad if we also have the opportunity of getting support from Sickle Cell Foundation of India to reach out to more community, especially the target population. For me, I feel core members, they are the best to reach out to because they are in that stage of their life when they will be thinking of marriage. A lot of people will be surprised. Actually, when we got there, quite a number of people discovered that genotype. And these are the people that probably have boyfriends, people who want to marry and all that. But we're able to educate them, and then they know that genotype. And people have been following up, calling, asking information. You know they are intentional about what they are doing. So we want to reach out to many people like that. And I think secondary school students too, especially those in senior secondary class, will also benefit from that camp. We are ready to do it. We might not have the resources, the Foundation can support. And so that would be one other area where we would like Foundation to support us. So we're open to partnership in other areas as well. We have in our team, like I said, a lot of professionals who also be involved, who also like to be involved in research activities on sickle cell. Because some of the way we can also promote the advocacy, as to have evidence for what we are saying. Like I forgot to mention the fact that in our support group, we carry out some research work, DT focus group. Ended interview with our champion to explore the life experience, and then look at the challenges, coping mechanism, and we were able to publish that in our impact journal. And one was published in PMC Public Health, that's life experience of Lagale with sickle cell disease. The other one was published in the Frontier of Public Health as well. These are Q1 journals. The other one is academic impact of living with sickle cell. The goal is to sensitize people to know that these people have some peculiar challenge. We're making advocacy that sometimes when they miss classes. Oh, I forgot to mention the fact that in Bowen, that's another interesting thing about Bowen. When our students, for whatever reason, on medical ground, when they miss classes or even tests or exams, they don't have problem. We just write to the head of the program, and that so they sorted out the program. So when you have crisis on admission, it's not a cause to fail. And that has been helping them. And I must say that a number of them are actually doing very, very well. As a matter of fact, the last convocation they did, one of our champions emerged as the overall best student in our college. And we are very proud of that. And we have had doctors from the group that have graduated. A medical student who has now become a doctor from that same platform. Quite a number of them are doing very well. And they also have this sense of advocacy. So people like that will be glad to work with Sickle Cell Foundation of Nigeria, and you'll be surprised at what they can do.
Okay, now thank you for giving me this opportunity to speak to the theme of sickle cell disease. It will interest you that I'm of the genotype SC. SC. But to the glory of God, I've come this far. It was precisely on 9th April this year, I will be 66 years of age. And I give glory to God for that. I want to thank God for the wise counsel of the people around me. Foremost amongst whom is Mrs. A. Ojo, my older sister who is presently at the Emory Medical Center in the United States. She gave a wise counsel way back in 1982 when she, as a medical lab scientist, tested all of us siblings and established that 3 of us were actually still of genotype SC. Foremost of the cancer was that in choosing a marriage partner, I should choose AA. And I made that decision that made my children to be AC and my grandson to be AA presently. So thereby helping to get rid of sickle cell. The second counsel is to stay hydrated. And as my physician, my ethnic physician, Dr. Adeleke, will say you are gold standard in hydration, because I always carry my water and I sip my water and I drink even while speaking in lectures and other forums. The other point that the other quality that I acquired along the line is to exercise within healthy limits. So to ensure healthy blood circulation and to check out my health status, especially the status of my eyes that are growing weaker by the day, for which I trust the Lord for. So importantly, these simple steps of care go a long way in ensuring that people like me stay healthy and continue to live to the praise of the glory of God. Sickle cell disease is not death sentence. If well managed, you will continually live to the praise of the glory. Thank you for